Hello and welcome to my channel. On this channel, we will be discussing everything medical coding, from what is medical coding to medical coding as a career, medical coding certifications, full courses in medical coding boot camps, and of course, the relationship between medical billing and medical coding. I am Miss Smith. Again, welcome. So, what is medical coding? Medical coding is the act of translating medical documentation into a standardized code set that can then be transmitted to an insurance company or third party payer in the hopes that it comes back as reimbursement. That's it. Of course, it's a little more detailed, especially the information that you have to know before you can start medical coding. But for now, we're discussing what medical coding actually is. Medical coding is like deciphering another language. It is translating something that you don't fully understand into something that everyone can understand. And so we'll take the example of abdominal pain. This patient is coming to the physician's office complaining of abdominal pain. So let's see if we can translate it into something that everyone can understand. So we take the documentation that we previously could not understand, we use our resources or our medical coding manuals to decipher the information that the physician documented here and get it into a final diagnosis code, which is R10, that everybody can understand. So, as I said, it's the act of translating medical documentation into a standardized code set that can then be transmitted to the insurance company, and I'll show you how. We use our resources or our medical coding manuals, it's then a medical coder's responsibility to make sure that they have documented to the highest degree of specificity and located the code the way they should in our medical coding book, and then finalized our medical record so the R10.0 can finally make it to a medical claim. Now, we'll have a lesson about the formal CMS 1500 form, what all that means when we do our series on revenue cycle. But for now, we're just explaining exactly what medical coding is. There's no other way that we can get all of the information that you see here in a form or format that can make it to the insurance company other than putting it into a alphanumeric code set that can then go in the position that it needs to go onto in this form and finally get transmitted to the insurance company. There's not another way to do this. So our goal is to get from the documentation to a standardized code set to a claim form, finally to the insurance company in the hopes that it comes back as reimbursement. And I keep saying in the hopes that it comes back as reimbursement because there is no guarantee that once a provider or healthcare provider sends a claim out the door that it is going to come back as reimbursement. Oftentimes it denies or pins or gets held up for additional information or for some other reason. So what we just described was diagnosis coding. There are other code sets that also need the same type of translation. Diagnosis coding is what the patient has or the physician's final assessment of what the patient has. The next code set would be procedure code, and that's the physician's assessment of what he had to do or documentation of what he had to do to the patient. And say, for example, the patient has some type of durable medical equipment or what we call DME that was prescribed to him or her for use, then that code set is called HCPCS or Healthcare Common Procedural Coding System. And then there's yet one more coding system called ICD-10 PCS, which is International Classification of Diseases, the 10th revision for procedural coding system, and it is a code set that is only used for inpatient services. So as you can see, The meaning of medical coding is quite easy, meaning that it's translation from documentation into a standardized code set, but it gets more difficult the deeper you get into it, especially with the knowledge that you have to have coming into the industry. So medical coding is a viable career, and like this slide says, healthcare is one of the fastest growing industries in the United States, and according to the Bureau of Labor and Statistics, it's going to experience a 16% growth over the next several years. And as you know, healthcare doesn't often feel the economic fluctuations of layoffs and risks like other industries do. So it's worth putting in the time and effort to see if this is something that you want to do. Also, there are certifications that you need to prepare yourself to obtain. So you will want to do the research on that as well. I think that's it. Like I said, I am Miss Smith. This is Smith Medical Coding Academy, and in the links below, I will have a link to our website where we offer boot camps that help you prepare yourself for nationally recognized coding certification. Thanks for watching.